Hey guys, Dr. Sami Nizam here of Alabama Surgical Arts. This is my partner, the one and only Joe Ivory. A little bit about us. I basically was looking for someone to bring into the practice who was an experienced orthognathic surgeon. Joe, why don't you tell me a little about yourself first?
Well, my name is Joe Ivory, Joseph Ivory if you want to be formal. I'm an oral maxillofacial surgeon. I completed a fellowship with a focus in orthognathic surgery and temporomandibular joint surgery at the one and only St. Louis Oral Facial Surgical Institute. Shout out to St. Louis. I've got over 10 years experience after residency, and I've done well over 1,000 major OR cases.
Awesome. And so that was the guy I was looking for. A little bit of background on myself. I am a board certified oral maxillofacial surgeon as well as a board certified facial cosmetic surgeon. So we both kind of have a background in this region of the face. We both started out working the bones of the face. I went on to learn the soft tissue components afterwards through a fellowship, and then he went on to learn further about the bony components of the face. Together, we feel like this is very synergistic and allows us to really treat any facial issues or any rejuvenation procedures you want in a holistic approach. And you kind of get a 2-for-1 deal with us because we both are able to treatment plan you and give you all the options available to you, from moving the soft tissue, moving the bones, giving what's going to be that best aesthetic look.
All right, so now that you've gotten to know us a little bit, Sammy, why don't you explain to them what we offer as far as facial cosmetic surgery?
Absolutely, Joe. Thanks for the tee up. So facial cosmetic surgery wise, just think anything from the collarbone up, facelifts, neck lifts, buccal fat pad reduction, rhinoplasty, blepharoplasty, brow lifts, really anything in the face region I offer. We also have a med spa, and in our med spa we do all the non-invasive things. Think Botox, fillers, things of that nature. And so really I like to tell everybody, just like you've heard that saying, when you have a hammer, everything is a nail. We are the complete opposite. We have like a hammer, a nail gun, all kinds of different things. So we really are able to do the full spectrum of facial rejuvenation and facial reshaping surgeries. That's where Joe comes in because he does a lot of the bony work. Joe, tell us a little bit about your end.
Absolutely. So as we mentioned before, my specialty or my area of focus is really in orthognathic surgery and temporomandibular joint surgery. So as far as the temporomandibular joint, I do everything from arthroscopy all the way up through arthroplasty to total joint reconstruction if necessary. On the orthognathic side, I can do upper jaw advancement, upper jaw expansion. We can do mandibular setbacks or mandibular advancements with genioplasty. And of course, both of us are all very well versed in the full scope of oral maxillofacial denoalveolar procedures as well.
So I know we talk a lot about our background as oral maxillofacial surgeons, and I think nowhere else is that shine than really some of our special interests. And mine is really facial implants, and indeed custom facial implants, which I think has been a quantum leap in the facial implant game, if you will. So basically before, implants were made and they were just off the shelf. You go grab a size. They do have sizers so you can try to fit, but they didn't actually fit your anatomy. So a lot of times what we would find is the implants would go in, and then if you went back and looked on a CT scan, and Joe, I'm sure you've seen some of these before, they're all over the place. They're not exactly where they're supposed to be because it doesn't fit the anatomy underneath. And you're working from a hole to put the implant in, a smaller incision. So it's just not an accurate process, number one. Number two, it's impossible to custom tailor it really to what you want it to look like. And yes, you can carve silicone to some extent, which most any implant really is made of, or a majority of them, but you can never get it to really have the proportions you want and sit exactly where you want on the bone. And that's where this custom facial implant idea came about. Now with modern technology, we can get a CT scan and we can look, and through experience, aesthetic knowledge, things that I've just gained over time from knowing how to do these cases, to get you the result you want. You know, say you come in and say, hey, well, I want my jaw augmented and I want the angle to be sharper. Well, we can custom get that angle to where you want it and keep the proportion of how far maybe we bring the chin down. And that's one of the really cool things about custom facial implants, are they're completely customizable to you and what your goals are. The other cool thing about them is they're completely reversible. So for a very permanent procedure that really hopefully you'll have for the rest of your life, let's say you don't like how much that angle came out. Well, we could always go back, replan the case, and bring the angle in a little bit and just switch out the angle component of the implant. And so really you don't have to feel like, oh, I made my decision or I'm trapped in it. There's simple ways to go back and adjust them. And the planning process is a really unique thing. I sit down actually with a biomedical engineer after I have that CT scan, and we spend really close to 30 minutes to an hour planning these cases. I come back, present that to you, kind of to show you, well, hey, I took into account what you wanted. This is why I did it, and see if it's okay with you. And And if you want to add something, or maybe you've had a second change of mind, say, no, I really want that angle to be really sharp, really loud, then we can go back and change it a little bit. And the company allows us to do a couple redesigns until we get it to where really we're both happy with it. And your thing of patient autonomy, that is very important to me. As long as we're doing it in a safe manner, I know that's going to avoid having complications. So really cool technology, and just I think something that really plays off of your ability to do orthognathic surgery. And I think your planning and stuff is actually, well, I know, is actually quite similar to mine.
Yeah, it really is, and that's one of the greatest, in my mind, one of the greatest advancements of orthognathic surgery in the past 10 years, and I actually got to see it firsthand evolve, was before, when we would plan these cases, we would get these stone models of people's teeth and articulate them, and it was so archaic, and you had no idea what the final outcome would be. But now you come in, we'll do a CT scan on you, we'll do full facial photos, 3D photos on you, we'll scan your dental arch, we can send that off to the biomedical engineers that we work with, and we'll sit down, we'll actually plan your case, and we can get a good idea exactly precisely how the move is going to look in all 3 dimensions. Also, we can get a really good idea of what your face is going to look like afterwards. And so, in the process of the years, just doing just hundreds of jaw advancements, setbacks, expansions, and everything else, and correcting dental facial deformities that patients present with, one of the things that has frustrated me the most is when you have someone that has got a significant asymmetry, like a microfacial or a condylar hyperplasia. And I can do all kinds of things like total joint replacements, arthroplasty, distraction osteogenesis, and everything else, but there's always that asymmetry in the angles, maybe in the chin, that we just can't do with orthognathic surgery, even with all the great advancements that we've had. But that's where working with someone who does custom facial implants really changes the game, because we can really work together to get you the result that you really want.
Yeah, and I totally agree with that statement. We have a lot of patients. I even have patients who've had orthognathic surgery before, and they look great. I mean, the orthognathic surgeon did a great job. Teeth are midline, smile looks nice, everything is really the greatest you can get. But prime example, somebody who wants more sharpness to their angle, orthognathic surgery really isn't going to be able to expand the width of the posterior mandible significantly. Another thing, if you're going to do a Le Fort 1, which is your classic surgery you're going to do to advance or impact or whatever you want to do to the top jaw, it's not going to affect the cheeks or the malar prominence. And a lot of these things really are harmonious with each other. So we want to make sure his movements are going to make my movements look good, and what I'm going to do with the implants, and vice versa. So planning these things together and having knowledge of how to do them together and coming from the same background, right, I think offers really just an awesome personalized experience that our practice is one of the few that really can offer that type of experience. And I think you nowadays too can do these procedures a lot simpler. Like you've even started doing them with Invisalign sometimes now, right?
One of the basic disadvantages of orthognathic surgery was the recovery time and just how much patients would really suffer afterwards. With a lot of experience like I've had, the operating time is much smaller. We don't have to wire people shut anymore. Sometimes we may have to in certain circumstances, but by and large, with the advent of mini plates, we don't have to wire people shut. We also don't always have to have people in braces. We can do things with Invisalign, so you can have your dentist set you up with Invisalign, and then you come to me, and then I can do your surgery and send you back for your finishing trays. And we also have the advent of things like long-acting local anesthetics that can keep you numb for up to 72 hours to really significantly cut down on the post-operative pain after these procedures. So it's really come a long way, and people are doing much, much better even after a double jaw surgery.
Yeah, and I think the takeaway from all of this stuff is technology in the last 10, 20 years has really changed the game as far as planning. Having 2 experienced guys that really kind of understand each other's surgeries very well, we've come from the same backgrounds, can really give you the result you're looking for, especially if you're willing to travel somewhere and you really want to get the best. Then I think we really offer very unique, really kind of best case scenario for this type of surgery. If you're interested, certainly go to our website, check out. We have a lot of information on there about both of us. You can set up a virtual consultation. We can tell you what our thoughts are virtually. If you have a CT scan, we can take a look at it. He can work with really an orthodontist from a distance if need be. We really can just make it a good experience for you and really give you everything we have to offer.
Absolutely. So we look forward to hearing from you.